Hello everyone, and welcome back to our channel. In today's video, we're going to thoroughly explore celiac disease, an autoimmune disorder that affects millions of people worldwide. We'll cover everything from its causes and risk factors to the diverse signs and symptoms, diagnosis, home management, and prevention strategies. If you find this information helpful, make sure to give this video a thumbs up and subscribe to our channel for more comprehensive health content. Let's get started. What is celiac disease? Celiac disease is an autoimmune disorder that affects about 1% of the global population. It occurs when an individual's immune system reacts abnormally to gluten, a protein found in wheat, barley, and rye. This abnormal response damages the lining of the small intestine, leading to malabsorption of nutrients and a variety of symptoms and health problems. It's essential to distinguish celiac disease from non-celiac gluten sensitivity and wheat allergy, as these conditions differ in their causes, underlying mechanisms, and diagnostic criteria. Let's take a closer look at each of these conditions to better understand how they differ. 1. Celiac disease. As mentioned earlier, celiac disease is an autoimmune disorder where the immune system reacts to gluten, damaging the small intestine. It's associated with specific genes, HLA-DQ2 and HLA-DQ8, and can lead to various complications if left untreated. 2. Non-celiac gluten sensitivity, NCGS. NCGS is a condition where individuals experience symptoms similar to celiac disease but without the autoimmune response or intestinal damage. The exact cause of NCGS is not well understood, and there's no specific diagnostic test for it. Diagnosis usually involves ruling out celiac disease and wheat allergy and observing symptom improvement on a gluten-free diet. 3. Wheat allergy. Wheat allergy is an allergic reaction to one or more proteins found specifically in wheat. It involves the release of histamine and other chemicals by the immune system, leading to allergy symptoms such as hives, difficulty breathing, and gastrointestinal issues. Unlike celiac disease, wheat allergy doesn't cause damage to the small intestine. By understanding the differences between these conditions, healthcare professionals can provide accurate diagnoses and appropriate treatment plans for each individual. Causes and risk factors. Celiac disease is primarily caused by a combination of genetic and environmental factors. Certain genes, such as HLA-DQ2 and HLA-DQ8, are strongly associated with the development of celiac disease. However, not everyone with these genes develops the condition, suggesting that environmental triggers also play a crucial role. Some of the potential environmental factors that might contribute to celiac disease include viral infections, gut bacteria, and the timing of gluten introduction during infancy. Additionally, celiac disease often runs in families, so if you have a close relative with the condition, your risk of developing it is higher. Signs and symptoms. Celiac disease can present with a wide range of symptoms that vary in severity, making diagnosis challenging. Some of the most common signs and symptoms include gastrointestinal issues such as abdominal pain, bloating, diarrhea, and constipation. But that's just the tip of the iceberg. Other symptoms associated with celiac disease include weight loss, malnutrition, fatigue, bone and joint issues, skin rashes, neurological problems, reproductive issues, dental enamel defects, and even psychological symptoms like anxiety and depression. The diversity of symptoms means that celiac disease can sometimes be mistaken for other conditions, such as irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, or lactose intolerance. Complications and long-term health issues. If left untreated, celiac disease can lead to a number of complications and long-term health issues, such as malabsorption of nutrients. The damage to the small intestine can result in poor absorption of essential nutrients like vitamins and minerals, leading to conditions like anemia and osteoporosis. Lactose intolerance. Damage to the small intestine may cause difficulty digesting lactose, the sugar found in dairy products. Infertility and miscarriage. Untreated celiac disease can cause reproductive issues in both men and women. Increased risk of other autoimmune disorders. Untreated celiac disease can increase the risk of developing other autoimmune disorders, such as type 1 diabetes and autoimmune thyroid disease. Neurological problems. Long-term untreated celiac disease can cause nerve damage, seizures, and cognitive impairment, among other neurological issues. Early diagnosis and treatment are essential to prevent these complications and maintain long-term health. Diagnosis and testing. Diagnosing celiac disease can be challenging due to the diverse range of symptoms. However, a combination of blood tests and, in some cases, an intestinal biopsy can help confirm the diagnosis. Blood tests typically screen for specific antibodies, such as tissue transglutaminase, TTG, and endomysial antibodies, EMA. A definitive diagnosis often requires an intestinal biopsy, where a small tissue sample is taken from the small intestine and examined for damage. It's important to note that blood tests for celiac disease should be done while the individual is still consuming gluten, as the test results might be falsely negative if the person has already started a gluten-free diet. Home management and treatment. The cornerstone of celiac disease treatment is a strict, lifelong gluten-free diet. By eliminating all sources of gluten from the diet, the immune system stops attacking the small intestine, allowing it to heal and preventing further damage. Managing celiac disease at home involves several key strategies. Familiarize yourself with gluten-free grains and alternatives like rice, quinoa, corn, and gluten-free oats. Read food labels carefully to ensure they're gluten-free. Also, be aware of hidden sources of gluten in processed foods, medications, and non-food items like cosmetics and toothpaste. Prevent cross-contamination by using separate utensils, cutting boards, and toasters for gluten-free items. Consult a registered dietitian for personalized advice on managing your diet and addressing any nutritional deficiencies with supplements, as recommended by your healthcare professional. Join online support groups or local celiac disease organizations to connect with others who are managing the condition and share tips, recipes, and resources. Prevention and reducing risk. While there's no foolproof way to prevent celiac disease, especially if you have a genetic predisposition, taking certain steps can help reduce the risk. 1. Introduce gluten-containing foods gradually to infants between 4 to 6 months of age while still breastfeeding. This might help lower the risk of developing celiac disease in genetically predisposed children. 2. Maintain a healthy, balanced diet rich in fruits, vegetables, lean proteins, and whole grains. 3. Be aware of your family history, as celiac disease can run in families. If you have a close relative with the condition, stay vigilant about any potential signs and symptoms. 4. Consult your healthcare provider if you suspect you have celiac disease, as early diagnosis and treatment are crucial in preventing long-term complications. And that concludes our comprehensive discussion on celiac disease, its signs and symptoms, home management, and prevention strategies. Remember, if you suspect you or a loved one may have celiac disease, consult your healthcare provider for proper diagnosis and guidance. If you found this video helpful, please hit the like button and subscribe to our channel for more comprehensive health content. Don't forget to leave any questions or suggestions in the comments section below. We'd love to hear your thoughts and experiences. Before you go, we have a recommendation for you. If you enjoyed this video, don't forget to check out some of our other related content. Just click on the thumbnails on the screen. It's packed with valuable information that you won't want to miss. Thanks for joining us, and we hope to see you in the next video.